All right, well, we might start. It's a very short session, so we'll maximise the time we've got. So good morning. Welcome to the Dementia Knowledge Network's first session in Dementia Action Week 2021. I would like to start by acknowledging the traditional owners of the land that I'm meeting on, and I think you guys are too, the Wurundjeri people of the Kulin Nation. I pay my respects to their elders past, present and emerging. Can I introduce Elizabeth Baxter, Dementia Services Specialist from BMCH and co-founder of the Dementia Knowledge Network, and myself, Sarah Yates, CEO of Caledonia Dementia Care and also co-founder of the Knowledge Network. Our theme today is Your Age Makes All the Difference. And we're going to pose this as a sort of Q&A between us with openings at the end for any questions.
Great. All right, so we'll just launch into it then. So what are we talking about today, Sarah? What services are we talking about?
So we're talking about services that help you to stay at home, help you to stay independent in your daily life. Things like domestic chores, cleaning, gutters, help with transport or shopping, and also things like assistance with showering, dressing and other personal tasks. You might also require nursing assistance for wound care or medication management. So those type of things.
And are services different for people over the age of 65 versus under the age of 65?
The services are basically the same, but how you access them and who provides them differs.
Okay, so even for people diagnosed with dementia, because they can be almost any age?
Yes, that's right. If you're diagnosed under 65, you can access one lot of services and supports. And if you're diagnosed over the age of 65, you can access a different system of services and supports.
Okay, so it's quite confusing.
Yeah, it is. It's really confusing.
So where do I go if I'm diagnosed over the age of 65 with a dementia diagnosis?
So you call My Aged Care on 1800 200 422. They'll be able to assess your needs and refer you to either the Commonwealth Home Support Program, so CHSP, or the Home Care Package Program, HCP.
Okay, and then if I'm under the age of 65 when I get diagnosed?
If you're diagnosed with dementia under the age of 65, you can apply for funds to pay for services that you need through the National Disability Insurance Scheme, NDIS. If accepted, you'll have to find a plan manager who'll assist you to negotiate your plan, depending very much on what services you as an individual require.
Okay, and so if I turn 65 while I'm accessing NDIS funding, do I then have to swap to the aged care funding stream?
No, you can stay on NDIS funding forever.
Okay, and if I'm over the age of 65 and I acquire a disability, can I access the NDIS?
No. If you're over 65, you are only eligible for services in the aged care system.
Okay, all right. So essentially, to summarise, over the age of 65, My Aged Care, or MAC as the acronym, is the key contact for assessment and services. And if you're under the age of 65, the National Disability Insurance Scheme, or the acronym NDIS, is the place that you go to support, for support.
Yep,
so,
that's right.
Great. So I guess, unfortunately, you have to be under the age of 65 when the diagnosis is made and when the referral is received by the service to be able to access NDIS, who will then determine eligibility. Otherwise, you will be automatically referred to the aged care system, which I think sounds a little bit more structured in its funding eligibility and service availability.
Yep. And it's probably best to get, if you are under 65, to get onto the NDIS as quickly as possible or as promptly as possible, because we have heard of people who've missed out by just a couple of days from the NDIS supports of getting their plan approved and having to then go to aged care services at quite a young age.
Okay, great. And I think in coming days and coming sessions, we'll go into a little bit more detail about services when you're over the age of 65 and then services when you're under the age of 65. But I think Sarah and I would like to open up the room here for questions, or we can talk a little bit more about commonly asked questions around initially accessing services, because I think we both acknowledge it's quite a confusing system. So does anyone have any questions at this point?
Hi, it's Nikki here. How are you?
Hi, Nikki.
I have, this is more of a personal question. So my mother-in-law's got Alzheimer's. Would we use the same My Aged Care for assistance, or do we go directly to the Alzheimer's Association?
Sarah?
So you can get your services, you should approach both is the answer to that question. Dementia Australia will be able to help you with help sheets about dementia specifically. They may be able to enrol you in an information course about dementia, and they may also be able to refer you to some supports for carers. But you also need to go to My Aged Care to organise an assessment for support in the home. Dementia Australia don't do that. They're more of an information, central point for information about dementia.
Great, thank you very much.
You're welcome.
Does anyone else have a question, whether it's general or about your circumstance?
If people are I would highly recommend the support coordinator. I'm managing much better at knowing I have someone to guide us and help us find services, because it's not always, we weren't offered it to start with. We were told that we could manage on our own, and it was so much more stressful trying to find the right people and the right things. So the support coordinator, if anybody is going down the NDIS route, go make sure you get one.
And Julie, can I just ask if you're comfortable to elaborate a little bit? What does your support coordinator do in helping to organise the services? Are you happy to speak a little bit to that?
Sure. Yeah, they're your advocate when it comes to renewing or reassessing, because you get a yearly review of the NDIS plan. Sometimes, I believe now, it can be 2 years, but we have a yearly one. And they know what questions to ask us as far as what our needs are and how to put them forward. I guess that's one of the biggest things, but also things like helping us find. We got a tracker watch for my husband, like helping us find the best one that suited us the best, so that if he goes off wandering, I can find him. It's basically somebody to call and say, I think I need this. Is there anything available? Or can you suggest anything that might help this scenario? So it's basically a backstop or your first port of call when you're wondering what on earth to do. And I've been lucky to have someone amazing along the way. Sometimes it's a bit of a hit and miss, and now Dementia Australia doesn't have the funding or doesn't provide support coordinators anymore, so I've had to find a new one. But yeah, it's just the biggest thing is knowing that if I'm stressed about something, or if I can't get something to work out, or I'm not sure about anything, she's the first port of call. For me, mentally, it makes a huge difference.
Thanks, Julie. Thanks. That's great to hear. And I think Sarah and I, and hopefully whoever attends, will be talking a little bit more in a couple of days about, you know, the ins and outs of accessing the NDIS versus My Aged Care. And I think a big part of this session is really to promote and encourage people to ask those questions. I think, there's a range of different services and they offer a whole lot of different supports and information and education. So I think Sarah and I would both like to offer ourselves up for anybody interested to contact us. We'd encourage you to contact My Aged Care, NDIS, Dementia Australia, and just start the conversation, because those of us working in the industry, it's our role to help source and find and do the legwork for you to help ensure that you're getting the support that you need.
And we also know that the system, particularly for people living with dementia, is quite confusing, as it's not based on the dementia itself, it's based, or your needs, it's based on your age. So yeah, like Elizabeth said, we encourage you to reach out. You don't know what you don't know until you ask some of those questions. So please use this as a resource. I will just drop an email address into the chat for anyone to reach out and use.
Does anybody else have any questions about your circumstances or anything you might have heard or wanted to query about that sort of initial step, that gateway into formal services? No? Okay, great. Sarah, do you commonly get asked specific questions from people who are new to your service or general inquiries from the public?
Yes, look, the first question people ask is, where do I go? What do I do? Most people know about Dementia Australia, which is great for their help sheets and their education, but they don't actually refer on to other services. So finding what services are around can be a challenge. And I know that people will often Google, and if they're in our area, will come up. So we do field quite a bit of those type of questions for people and provide information to carers about where they can go and what they can access.
Yeah, great. And I think something else that might be worth mentioning is that Sarah and I not only co-chair a dementia-specific network, but we're involved in other networks as well. So healthcare professionals do collaborate and do talk about what services they each provide. So the theory behind that is that we should then be able to have a bit of an idea over not only what our organisation that we represent can provide you in terms of support and advice or case management or support coordination, but also refer you on, because you don't have to only access one organisation or provider. You're generally eligible, and I think most people require services from more than one place. So that's also something worth knowing. Right. And I suppose something that is worth mentioning as well, and I guess highlights again the confusion around how services are set up. Sarah and I have both been in the industry for quite some time, and people who have a diagnosis of younger onset dementia actually used to fall under the aged care funding. So I think that can confuse people as well. We have both, Sarah and I, in our respective roles in organisations, supported the one family who, this was going back probably 6 or 7 years now, who actually accessed services from, I'd say, 5 or 6 different providers. Do you think, Sarah?
Yeah, at least.
Yeah, so I think there is also scope for us to think outside the box. We're working with people, so it's, we're not working in factories with stock standard boxes or items that are all the same size and shape with the same needs. So again, we would really encourage you to, put forward what you're wanting and what you're needing. And if it doesn't currently exist, we'll put our heads together as service providers and try to see if we can come up with something new to meet those needs. And actually, an example of that, Sarah, do you want to talk to a new support group that's just been launched by Caledonia?
Yeah, we had heard in various network meetings and at the Knowledge Network that there was nothing out there specifically for carers of people with younger onset dementia. There were some education programs provided by Dementia Australia, and people had gone through those and met fellow carers, but nothing continued on. So because everybody's on Zoom at the moment, and it is so easy just to open a Zoom room and invite people to come. We've started a younger onset dementia specific carer support group online every Monday afternoon at 2 o'clock. You don't have to be a member, client of Caledonia to come along. Anyone's welcome. We've got people from all over Melbourne and one guy from interstate as well. So if anyone knows of anyone or would like to make any referrals to that or find out more, please feel free to contact me. But that was a direct result of hearing at those network meetings that there was a gap in services for carers of people with younger onset dementia.
Great. Yeah, it's exciting hearing about new initiatives and new groups that are being launched. And I think, again, that is certainly a possibility. So if you're seeking something that you can't find or doesn't currently exist, please do bring it to our attention. And Sarah and I love a challenge, love thinking outside the box. Yeah, and I think we'll talk in coming sessions around services that are both very much in the mainstream sort of service pathway that you're very likely to hear about if you access My Aged Care or the NDIS. And we'll also talk a little bit in a later session about some services that you might not have heard about. So they're a little bit left of centre, or they're social media based, or they're sort of, you know, run by community, that type of thing. So yeah, a whole range of services do exist out there. It's just a matter of knowing what they are and when and how to access them.
Yep, right.
So does anyone else have a question or anything you'd like to say or query or bring forward?
Nope, they're all just soaking up the knowledge. I think that was a really good session as an introduction to dementia and Dementia Action Week and what services are available. And like Elizabeth said, the further sessions will have a lot more detail on specific topics. If anyone would like to know what's coming up, because I realised that didn't go on, did that go on the flyer? No.
No, it didn't.
Please let me know, and we can let you know what topics are coming up in the coming days. They'll run this week, next week, and Monday of the week after.
Yes, yeah. And so same time each day, 10:30 until 11. Yep. And we really do encourage your involvement, feedback, questions, anything you'd like to bring along, please do, so that it's not just Sarah and I talking all session, every session, which we could do, but it might not be as exciting. So
Elizabeth, I've got one question.
Yes.
I'm aware that the sessions are being recorded. Are these going to be emailed out or placed somewhere for us to have access, or for those that couldn't attend so that they can go back and watch them?
Yes, Brett, they'll be on Caledonia's YouTube channel, and I will, I don't have all your email addresses, but so how will I let you know that they're on? Just search Caledonia's YouTube channel, I'll put them up.
Yeah,
or drop me an email address in the chat box.
Yeah, maybe that's a good start. And then everybody who attended here can get the link to that recording. And if you then want to forward it on, you're more than welcome to. So maybe pop your email address if you're happy to, just in the chat box. Otherwise, we might send out the links with the all of the distribution of the advertising of these sessions. So anybody who received the promotion of this session should also receive the link to the recording.
And I'll put it on our website, which I've just dropped there. That might be easy as well.
Oh, great. Thank you very much. Thank you for coming, everyone.
Thank you, Sarah. Thank you, Elizabeth.
It's a pleasure.
Thanks, Sarah.
Nice to
Thanks,
see you
Elizabeth.
all.
See you tomorrow.
Bye.
Thanks.
Bye.
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 Okay, so